some of our attention away from just COVID, because there are other illnesses that we need to track and continue to monitor. And in our area during these summer months, particularly it's tick-borne illness. A huge misconception, I have to call anyone who's positive with a tick-borne illness. And I say tick-borne illness because it's not just Lyme disease. In our immediate area, the most common that we see, of course, is going to be Lyme. But there is babesiosis, anaplasmosis, Rocky Mountain spotted fever, which people are surprised because it's in our very backyards. The Powassan virus also in the East Coast, but most notably I would say that anaplasmosis and babesiosis are in our immediate area and are just as prevalent as Lyme disease and require treatment and attention just the same. So I think another misconception is that all ticks have the potential to carry one or all of these diseases. You can have Lyme disease and with that same tick bite can also carry babesiosis and need treatment for both diseases. So all ticks have potential to carry one or all of these diseases, not just deer ticks. Symptoms can show up 3 to 30 days after a bite. That's an important fact to remember, because when I'm calling and investigating where you may have been, people only think back for the last 2 or 3 days, when really it could have been a cookout a month ago. So that's important to think back when you're trying to relate it to tick-borne illness. Everyone pretty much knows the basic symptoms of what they think is just Lyme disease: fever, muscle joint pain, headache, rash, fatigue. Everyone wants to look for that bullseye rash, but in all honesty, most people don't get a bullseye rash at all. So to look for that significant change is really not enough. Sometimes a rash will develop in places where you can't see it. A lot of times if they do develop a bullseye rash, it's that someone else pointed it out to them. It's on the back of their arm, behind their knee, somewhere on their back or on their head that they wouldn't be able to see. So it's important to monitor how we're feeling. And again, where so many of these symptoms, our first thought is COVID. If you've taken a COVID test and you're negative, and you haven't been around anyone else who is positive for COVID, and you do suffer these symptoms, it's a good idea to just self-advocate and let your doctor know, and you can certainly let them know the concerns that you have about possible tick-borne illness. Oh, another important note is that symptoms can arise and clear on their own. So you can develop a fever and develop symptoms of what you think it passes and you think it's gone, and then a month later you can develop severe joint pain, and now there's no correlation between the symptoms that you had maybe a month prior to this new onset of joint pain. Again, a good idea to think about: where have you been? You don't have to find a tick embedded on you to have this be a concern. Most people think that, well, I never found a tick bite or I never found a bug bite. You don't have to. A tick can transmit disease with a bite and fall off and never find that tick. And of course, we do know that most of them are so small, the size of a poppy seed. I don't know that anybody would really be able to detect that on their own. So it's important to monitor ourselves for these symptoms. So with prevention, it's wearing proper clothing when we are outside in outdoor activities, high socks, light colored clothes, so that we're able to see if we do have any of the larger ticks on us anyway. Bug spray with DEET. I know a lot of people don't like to apply DEET directly onto their skin. You can apply it to the outside of your clothing and it's effective. You can apply directly onto your skin more natural sprays scented with lemongrass, lavender, eucalyptus. Anything that's strong scented will hopefully, in combination with using DEET on our clothes, help to protect us. Coming in from outdoor activities, removing those clothes as soon as possible, showering, frequent body checks. Behind the knees, armpits, groins, hairlines, and behind ears are common spots that we should check. Another huge thing is treating our pets, because they're huge culprits for bringing in ticks from outdoors. So having them treated and doing frequent checks on our pets. And again, just even being at the beach, no one really thinks about being at the beach or walking through high grasses. They think wooded areas when it comes to ticks, but they are just as plentiful in those high grasses at the beach as well. 2021, from April to September, there were 52 cases of tick-borne illness. 30 of those were of Lyme, and the rest were babesiosis and anaplasmosis. And again, these are just the residents of Fairhaven. This doesn't count the people who may have visited our towns, our beaches, our bike paths, our parks, and then have contracted disease from the area, the local area. Bottle of gas and drive away, and that's really not very effective. Some more effective treatments are actual product that you can spread onto your lawn. It'll kind of help to keep it more at bay. And just really creating barriers and borders. So, mulching and just making that barrier between a treated area versus an untreated area, so that people who are outside, children, animals, know that, this is a safer zone.